Hello, I'm Kirstin Weider. I'm a physical medicine and rehabilitation physician at Signe Spine and Rehab with a subspecialty in interventional spine and musculoskeletal medicine.
Hello, I'm Kevin Smith. I'm a doctor of physical therapy and a strength and conditioning specialist.
In this video, we'll be discussing one of my personal favorites, the Deadbug exercise, and we'll be going through some progressions or variations of this exercise as well. All right, so to set up for the Deadbug, we're gonna lay flat on a relatively firm surface. That might be the floor, or here we have tables in clinic. And the first step is finding a neutral core position. So we don't want those hips tilted too far forward or too far backwards. We want a nice neutral position. You can think about pressing that low back gently into the table. You don't have to squish the table, but just gently pressing that low back into the table can oftentimes find a nice neutral position. From there, we can bring the arms up overhead. And the first variation is going to be just using those arms, starting to fire up those core muscles. If this feels stable, comfortable, pain-free, we might progress to lifting one knee off the table, again, opposite hand to opposite knee, and then stretching out. And if this is still feeling comfortable, maybe we progress to both knees up off the table. This is kind of that full expression of this exercise here. Again, any of these along the way, we're just looking for that point of a little bit of challenge, but pain-free. If this is still feeling really comfortable, you've been practicing it for a while, maybe this is where we start to add in some light weights or a little external load for more challenge. Kevin, how often do you usually recommend patients do these exercises? How many sets, how many reps?
Absolutely. So with any of these exercises that we think about, we're looking to start roughly at about 2 sets of 10 and slowly increase over time as tolerated. So something we can do is increase either the repetitions or the sets. So what I like to do is start at that 2 of 10 and maybe go to 2 sets of 15 or 3 sets of 10 and then slowly increase as we can.
So that would be 10 on one side, 10 on the other side, pause, 10 on one side, 10 on the other side, pause.
That's exactly
like
correct.
That.
Yes,
Perfect.
we generally like to see an alternating principle with any of the exercises that we're giving you.
Excellent. If you're a patient at Signe Spine and Rehab or Results Physiotherapy, you can also reference page 2 of our Trunk Stabilization Packet for more details about these exercises.
Remember to perform all exercises within your pain tolerance. Let pain guide you. And if you have any questions or concerns at all, don't hesitate to reach out to your qualified healthcare provider.
Follow along in the next video for more information about additional core stabilization exercises.